At monthly intervals, an egg matures and is released from the ovary, and this is known as the ovarian cycle. The uterus has been ready to receive and nurture the embryo, uterine or menstrual cycle. If fertilization does not occur, then the uterine provisions are discarded as menstrual flow. If fertilization occurs, a hormone, human chorionic gonadotropin, produced by the embryo, helps to maintain this corpus luteum. HCG, or human chorionic gonadotropin, is the hormone. It's a monoclonal antibody that is detected in pregnancy tests. So that's what a pregnancy test is detecting, is levels of this HCG. Hormones of the corpus luteum maintain the endometrium, keeping it from shedding the progesterone and the estrogen. Hormones that control female fertility, as in males, is regulated by the gonadotropin releasing hormone of the hypothalamus. FSH and LH cause the ovaries to release estrogen and progesterone. So the gonadotropin, the hypothalamus, is going to facilitate the anterior pituitary gland releasing FSH, or follicle stimulating hormone, which is going to stimulate the follicle development. Luteinizing hormone is going to trigger ovulation, or the release of the egg. The ovaries is going to facilitate production and release of estrogen and progesterone. Estrogen is going to serve to develop the endometrium and also plays a role in the female sex characteristics. Progesterone helps to maintain the endometrium. Exposure to chemicals that might block estrogen and progesterone maintenance can result in menstruation, and thus would incur the endometrium being lost as menstrual flow, and would be a miscarriage in pregnant females. And so this just shows the cycles where a follicle stimulating hormone is going to develop the development of the follicles in the ovary. Luteinizing hormone is going to trigger ovulation, or the release. Luteinizing hormone will cause the transformation of the follicle cells remaining in the ovary into the corpus luteum, which is going to serve to secrete estrogen and progesterone, maintaining that endometrium. Follicle cells in the ovary are going to secrete estrogen. Estrogen and progesterone stimulate the development of the uterine lining, the endometrium, preparing it for pregnancy. If pregnancy does not occur, if fertilization does not occur, and implantation does not occur, then the endometrium is shed as menstrual flow. Menopause is when females cease to ovulate and menstruate, thus the reproduction system, the reproduction possibilities end at that time as well. It usually occurs between the ages of 45 and 55. Menopause does not occur because women run out of eggs, because if you recall, we discussed earlier the strategies of the females that at birth are left with at puberty are left with approximately 200 to 400,000, which will continue to decline over time, but a female will only ever use approximately 400 of the eggs that she has, one a month, over approximately a 36-year period of menstruation. Physiological effects caused by associated with menopause and the drop in estrogen is loss of the fat layer that may lead to wrinkles, also breast reduction, disruption of the thermostat, the hypothalamus, which causes hot flashes, vaginal dryness or growth of facial hair, because at this time testosterone released by the adrenal gland predominates, since estrogen is no longer a hormone being produced. It also increases the risk of diseases of the heart and blood vessels. Up until menopause, males have a slightly higher risk of cardiovascular problems, but after menopause, women become equal. Also, as well, osteoporosis, because the loss of estrogen also facilitates the ability to reabsorb calcium. Premenstrual syndrome, or also known as PMS, is typically appear a week to 10 days before the period. May include depression, irritability, fatigue, or headaches. Some research shows that it may be caused by a deficiency of progesterone. Treatments or medications that raise serotonin. Changes in diet, such as avoiding caffeine, alcohol, fat, and sodium. Also, increase foods high in calcium, such as potassium, magnesium, and manganese. Aerobic exercise, at least 30 minutes a day, stimulates the endorphins, which release that sense of pleasure. Menstrual cramps are caused by high levels of prostaglandins produced by the endometrial cells. Prostaglandins chemicals are used in cellular communication. These are released by the plasma membranes of cells. These prostaglandins cause the smooth muscle cells of the uterus to contract, and these muscle spasms may lead to pain by reducing blood supply to the uterine muscles. The lower blood supply, thus the lower blood delivery, results in this pain. Endometriosis is a condition in which tissue from the uterine lining is found outside the uterine cavity. Endometrial tissue, regardless of wherever it is, grows and breaks down with the menstrual cycle hormonal changes. Women with endometriosis have a more difficult time becoming pregnant. This is because the endometrial tissue may block the oviduct or even coat the ovary. Pelvic inflammatory disease is an infection of the pelvic organs. Pelvic inflammatory disease affects more than 1 million women a year. It's caused by a variety of organisms, and pelvic inflammatory disease is just a general term for infection of the uterine lining, oviduct, or ovaries. In both men and women, sexual arousal and sexual intercourse involve physiological changes, vasoconstriction, congestion, and myotonia, which the vasocongestion would be the glans penis and the clitoris, in which the certain tissues fill with blood. The myotonia allow or certain muscles show sustained or rhythmic contractions. The 4 stages of sexual response include excitement, plateau, orgasm, and resolution. Excitement is just the sexual arousal that increases during foreplay, preparing the penis and the vagina for intercourse. The vaginal wall begins to seep fluid, partly as a result of the increased blood flow. Breathing and heart rate may also increase during this time. Plateau is when the sexual arousal is maintained at a very high level. Increased blood flow results in organ enlargement and muscle contraction, and again, increased breathing and heart rate. Orgasm is just the brief, pleasurable moment of sexual response cycle. Resolution is just when the body returns to normal level. Typically takes longer in women than in men. Women can become aroused again during this phase, which typically men cannot. Birth control, of course, prevents pregnancies, and in some cases, such as a condom, can reduce the risk of spreading sexually transmitted diseases. Birth control abstinence, this is just refraining from sexual contact, and the most reliable means of avoiding both pregnancy and spread of sexually transmitted diseases. Sterilization is when a cutting and sealing of the gamete transport tubes that will permanently prevent fertilization, but it offers no protection against sexually transmitted diseases. In males, this is known as a vasectomy. In a vasectomy, the vas deferens, which delivers the sperm, is cut to prevent the sperm from leaving the body. The semen still would contain the secretions of the prostate gland, the bulbourethra or Cowper glands, as well as the seminal vesicles, but would not contain any sperm. Because sperm composes approximately only 1% of the semen, the volume of semen ejaculated is not noticeably reduced in males who have had a vasectomy. In females, it's known as a tubal ligation, and entails the oviducts are cut to prevent the egg and the sperm from meeting and fertilization occurring. Hormonal contraception currently is only available to females, does not protect against any sexually transmitted disease, and in some cases may even increase the risk of transmission. Two basic approaches is combination of estrogen and progesterone, or some with progesterone only. Those that use a combination of estrogen and progesterone use the synthetic forms that are going to suppress the follicle stimulating hormone and luteinizing hormone. So thus they prevent the maturation of the egg and its release from the ovary. Some include the pill, the patch, or even the vaginal ring. Pardon me. Progesterone only birth control uses synthetic progesterone, may serve to prevent ovulation or thicken the cervical mucus, which makes it difficult for the sperm to fertilize the egg. It also serves to keep the endometrium unprepared for implantation. So it does not provide a favorable, serves to not provide a favorable environment that if fertilization were to occur, for implantation to occur. Because estrogen is not used, it keeps the endometrium from properly preparing for implantation of the embryo if fertilization should occur. IUD, or intrauterine devices, is a small device inserted into the uterus by a physician, which prevents the union of the sperm and the egg and or implantation, but it does not protect against sexually transmitted diseases. With the intrauterine devices, pelvic inflammatory disease is a risk associated with IUDs. Risk is greatest in the weeks following the insertion because disease-causing organisms can enter the uterus from the vagina at this time. Barrier methods to prevent fertilization includes the diaphragm, cervical cap, contraceptive sponge, male and female condoms. These all vary in degree of protection offered against sexually transmitted diseases. No protection from the cervical cap to good protection for a latex condom. And this just shows image of the various contraceptive methods. Spermicidal preparations kill sperm and therefore prevent fertilization, but they're only effective for approximately an hour once activated. Different forms may be foam, a tablet, cream, or jelly. Spermicidal preparations also kill organisms that could be responsible for sexually transmitted diseases, but the spermicidal preparations may also damage the cells of the vagina and therefore increase the susceptibility to sexually transmitted diseases. Fertility awareness is also called natural family planning or the rhythm method. Sounds easier than it is because sperm can live in the reproductive tract for 2 to 5 days. This is just when individuals avoid intercourse when fertilization is likely to occur. But it's, like I say, it's challenging to determine this. Morning after pills or emergency contraception and taken within the first few hours after unprotected intercourse. 2 types combine estrogen and progesterone, and Plan B is progesterone only. Typically, you can purchase these over the counter if you're 18 years or older. With either type, the first dose should be taken within 3 to 5 days of unprotected sex, and the second approximately 12 hours later.